Good morning, everyone. I am staffing a 24-year-old African American female who is a single active duty service member. She's been active duty for the last 6 years and she is self-referred. Her presenting problem is issues with concentration. She recently started the nursing graduate program, and she says that she has been so overwhelmed that she has started procrastinating due to these concentration issues and some memory issues as well. Her grades are beginning to suffer. She says that these symptoms began about 2 months ago, right around the time she joined the program, and the memory issues and concentration issues last just about all day with any task that she is given, and she has to concentrate intensely to remember any of her school stuff. The concentration issues are impacting her daily functioning because her grades are beginning to suffer. The last time she had issues like this were in elementary school. She had some concentration issues, says that she didn't sit still well at school, and her parents had her evaluated, and she was medicated for these issues. The medication seemed to help. At this time, there are no current safety concerns. Her relevant medical history is that she was involved in a car wreck when she was a child around in elementary school, and that she suffered a concussion at the time. She was seen by doctors, and then she noted that not long after that is when she began to suffer from concentration issues in school. Again, she was medicated, medication helped, and there was no further medical planning after that. She was medicated through high school, but has not been medicated since high school or at any time during her military career. The current working diagnosis is that she has adjustment disorder with anxiety. She noticed some other symptoms that were congruent with anxiety: chest tightness, palpitating heart, breathing, feeling like she can't breathe, things like that. I do recommend that she be referred to her PCM just to have something to check to make sure there's no residual effects from the concussion that she had as a child. My reasoning for this adjustment disorder with anxiety diagnosis is that the onset was about 2 months ago, and it is causing significant impairment in her current occupational setting. The remarkable mental status exam findings were that this client did not remember the short-term memory assessment that was given. She was given 3 words to remember. By the end of the assessment, she cannot remember those 3 words, which is congruent with her presenting concern, and also why I recommend a referral to her PCM. The prognosis is good. The client has a great support system, and she is incredibly motivated to get better before things get too bad out here. And she has shown that she has the ability to work well outside of this environment. Again, 6 years active duty service member, has had no issues with concentration, unmedicated up until recently. She has a great support system. It includes her mom, her dad, both siblings, and she's also really close to her friends who are local. She is, again, very motivated, and her professors seem to also be on her side. She has communicated with them, and they have also noticed her grades suffering and are communicating with her on that. The barriers for her to getting care are just really her school schedule. She has an intense school schedule, and we would have to work around that school schedule in order for her to get treatment here. Right now, she is of low risk, and she has high protective factors, a lot of a supportive environment, incredibly motivated individual. The preliminary plan now is, again, that referral to her PCM. I think individual therapy would benefit this client. Problem-solving therapy seems like a good route. It is a form of CBT, and it will help her find solutions to her current problems that she is struggling with. There's no mandated reporting issues at this time, but because she is active duty, we may have to report to command for accountability. At this time, there are no other notes. Thank you.